A 10-year-old boy presented with bilateral facial swelling along with the eyes raised to heaven appearance. What could be your diagnosis? The answer is cherubism. Cherubism is characterized by eye upturned to the heaven appearance. What you would see is there will be involvement of inferior and lateral orbital walls that tilt the eyeball upward and retract the lower eyelid. So it will expose the sclera below the iris that produces eyes upturned to heaven appearance. So this cherubism is a rare developmental jaw condition that can be inherited as autosomal dominant trait, and the gene that is associated with it is SH3BP2 gene. The name cherubism was applied to this condition because the facial appearance is similar as that of plump cheek little angle. So the plump cherub-like cheek results from the painless bilateral symmetrical expansion of the posterior mandible. In the mandible, the lesion frequently develops in the ascending rami and coronoid process, but the condyles usually are spared. Extensive jaw involvement causing marked widening and distortion of alveolar ridge. The lesion may cause tooth displacement, tooth mobility, failure of tooth eruption, impaired mastication, speech difficulty, upper airway obstruction, or vision or hearing loss. On radiograph, what you would see is typically it shows bilateral multilocular radiolucencies. Biochemical findings typically are normal in patients with cherubism. If laboratory results do not suggest hyperparathyroidism, then the children with bilateral symmetrical giant cells represents the example of cherubism. So on a microscope, what you would see is vascular fibrous tissue with variable number of multinucleated giant cells and scattered hemorrhage. So these giant cells tends to be small and aggregate focally. The cherubism reveals eosinophilic cuff-like deposits surrounding the small blood vessels. So this eosinophilic cuffing appears to be specific for the cherubism.